Welcome back. April is Oral Cancer Awareness Month. You know, more than 54,000 Americans will be diagnosed with oral cancer this year, and it can be life-threatening. So we've got the experts in to talk about this. Dr. Melanie Petty, a pediatrician and e-cigarette champion of Alabama, joining us now to talk more about the risk factors. Very important information here. Dr. Petty, thank you for stopping by.
Thank you so much for having me.
So I want to start first with what oral cancer is.
So oral cancer, it's going to be a cancer of, your oral cavity, even some people thinking about your lips as well.
And what are some of the risk factors?
So one of the major risk factors for developing oral cancer is tobacco use, chewing tobacco, cigarettes, cigarillos, also alcohol consumption, frequent or heavy consumption of alcohol, and also the human papillomavirus, or what we call HPV.
Now see, that is interesting. Most people would think that it's solely related to tobacco, but you just listed two other risk factors.
Yes, and the thing with the alcohol use is that in combination with tobacco use, it can actually increase your risk for oral cancer.
Now, you also mentioned HPV. We've reported on that quite frequently. The vaccine, is that enough to protect you from this oral cancer? That's
a really good question. So with the HPV vaccine, it can protect you against some strains of HPV can cause certain types of oral cancer, and it can protect you.
And so people who are smoking and they stop, does that immediately reduce their risk for oral cancer? And is smoking worse than, say, chewing tobacco?
Well, that's another good question. So anytime that you quit smoking or using tobacco products, that is going to lead to better health outcomes for anyone. And the thing is that with smoking, using, chewing tobacco, they can both put you at increased risk for having oral cancer. So I would say, try to stop both. And I know sometimes when you go to the dentist, they check your gum line. Are they looking for oral cancers? Is that one thing that you would suggest people do? Make sure they get those routine checkups? Yes. That is one thing that, our dentists do, especially with our adult populations, are those people that are in those high-risk categories as well. Since COVID, a lot of people have had hardships or just afraid, to go for their regular checkups. So I'm imploring everyone, go for your regular checkups, go for your screenings for, the pediatric populations, for HPV vaccines that we know can prevent certain strains of oral cancer. Take your kids in. We start giving that at 11 and 12 years of age. And you can also get the HPV vaccine through the age of 26. So check with your medical provider about where you stand.
All right, very good information. Thank you so much, Dr. Petty, for stopping by.
Oh, thank you for having me.
And you can watch this interview again, share it with someone you know. We're going to have it posted to our YouTube channel shortly. You are missing out if you haven't already subscribed. So go ahead and click that bell, subscribe to the Fox 10 YouTube channel. You'll never miss an alert when a story is posted.